Well, what I think about is the most important thing when you're looking at a center of excellence is experience. So in our group, our particular group, the class of experience is going to be very high. This is a highly specialized field. So not only do you want to have your outcomes to be great, you want the patient satisfaction experience to be top notch. Yeah, so the initial consultation you'll have is with one of the surgeons, so like myself. So if you're an out-of-town patient, that works to facilitate by video conference or teleconference. And we live in a day and age now that's becoming very mainstream. Fortunately for us, we've been doing telemedicine for over a year now, and we've worked out a lot of the kinks, and now it's very streamlined, and a lot of patients are loving that experience. From the patient standpoint, it's very convenient. You're in your own location, you feel very comfortable, and we feel very comfortable when we do our initial consultation. You're not necessarily bogged down into a consultation room. We'll be able to go through a lot of that information with you specifically to your case to make, again, your experience that much better. Well, it wasn't until recently, in about 2013, that the American Medical Association really declared obesity as a disease. And what is that? So it's anyone who has a body mass index over 30. That becomes a disease process. And why do we talk about that? Because we want to let that sort of bad name to obesity, we want to put that aside. We want to offer a treatment. So who is a candidate for treatment of bariatric surgery? So if your body mass index is at least 30, 35 or above, and you have diabetes, hypertension, or sleep apnea, this is the number one thing that we're going to treat. Is not only the weight, right? We want to treat underlying diseases such as diabetes, hypertension, and obstructive sleep apnea. You'll be surprised that within 24, 48 hours after surgery, things like diabetes can actually go away almost completely, depending on how long you've had diabetes. So if your body mass index is over 40, you have severe disease, and this is somewhere where you really seriously want to talk to your doctor or your surgeon about what your treatment options are. Treatment options would be two of the most popular is sleeve gastrectomy or a gastric bypass. And that would be a conversation that you would have to have individually with your surgeon. But to keep that in mind when you go and do your review or your research on what is best for yourself, looking at a sleeve gastrectomy and gastric bypass, very powerful tools that we have to treat body mass indexes which are elevated over 40, over 35 with diabetes, hypertension, or sleep apnea. So when we talk about the results, we have to really talk about what is body mass index, right? That is your weight over your height, and you'll get a number. When it's really elevated, 40 or and above, we're looking at about 60 to 200 pounds of weight loss that a sleeve gastrectomy or a gastric bypass can offer. Now, if you think about it, we want it to be sustained. So when we talk about results and weight loss, we want that 60 pounds or 100 pounds that you need to lose to be sustained over time. And this is why coming to a program where there's an excellent result and long-term results is really important, because it's not just a surgery, it's not just a treatment and then you're done. There's a lot more aftercare that's involved, and this is what's really important. So what are the expected outcomes? You expect to have a weight loss of 60 to 200 pounds with the sleeve gastrectomy, or around 75 to 250 pounds with the gastric bypass. When we talk about results of metabolic diseases such as diabetes, hypertension, or obstructive sleep apnea, again, diabetes can go away within 24 to 48 hours after surgery. So it's not just related to weight loss. It's related to a metabolic shift that could happen immediately after surgery. There's a lot of research going on why this happens. It's very exciting, and we're very passionate about that. So when you have these kind of results, you really want to be with a program that offers that continual aftercare, so that this could be a sustained weight loss and a sustained resolution of comorbidities, not just for the surgery and then you're done. This is what we're really after, and this is, I think, what a center of excellence should look like and should offer in long-term outcomes. So why do surgery? Why go after a type of treatment that is invasive? And it is surgery. There are excellent benefits, but there are also some risks involved. And when you consult with your surgeon, you want to be able to go over those in detail, specifically to your case. There are a lot of things you're going to want to hear, and there's some things you don't want to hear, which is very important. But that's the reality of what we're offering. Now, the other thing I like to talk about is we talk about patient outcomes as it relates to number of weight that they lose, the weight loss itself, or the resolution of diabetes, the medical aspect, the obstructive sleep apnea, the hypertension, the joint pain, the back pain that goes away after surgery. But what I like to hear is when my patients talk about their related outcomes. Why did they do this in the first place? I usually find out that it really wasn't about the weight loss. It really wasn't about diabetes or sleep apnea or hypertension. It was about wanting to get back out there with their families or to exercise, just do those little things that we take a lot for granted. Going and traveling, fitting inside airplanes, fitting inside roller coaster rides, those kind of patient-related outcomes, getting on a bicycle and riding again, especially with your kids, your grandkids, your family, or with your spouses, your loved ones. That's what I hear the most from patients, and I think that's really exciting. From the surgeon's point of view, yeah, I love to get rid of the diabetes. I love to get rid of the sleep apnea and get the weight loss and have you look good and feel good. But when I hear stories of how you were able to get back on a bicycle, or you're able to get back walking again without that pain, that's really exciting to me.
Surgeon.
Yeah, so how does this whole process of traveling work? Well, you'll have a phone number you'll be able to contact, and once you make that point of contact, you'll have the meeting with our office. My office meeting is simply a verification of who you are, the basic information, all that boring stuff, right? But then you get your first interview with your surgeon, like myself. And this will usually be done by telemedicine or video conference. That would be the initial consultation. After that, that opens the door. You have anytime you can have any questions, any concerns. You always have that communication with me or your surgeon, which is what's the key. It's not just one interview. You can have multiple interviews and not be afraid to call multiple times. When you have your date, all right, there'll be a process, and the office will walk you through that process. You don't even have to think about it. We want to take all of that. Those obstacles that you need to go on the way, or your steps that you need to go on the way, our office will take care of that. They'll guide you along. You'll have a patient advocate, and you'll have a office personnel that will take you through those processes. But meanwhile, once you make that connection with your surgeon, you'll be able to speak with him, ask him questions, email the office, and we'll be able to streamline that and want to have that, build that connection with your surgeon. Once you have your date and you have your surgery date, the travel plans will be, of course, hold on.
Yep.
So once you have your surgery date, Carum Health will facilitate your travel plans. And then you'll have a pre-op, what's called a pre-op interview with your surgeon. That could either be done in person or another video conference. The day of surgery is ultimately the day you'll have a face-to-face conversation with your surgeon, and that's really usually an exciting day. It's really crossing out all your T's, dotting all your I's, and it's an exciting day. Everyone's nervous, but also very excited.
Because?
Yes. So what does it mean to have a center of excellence? Well, collectively, we were chosen to be your surgeon because we have over 10,000 cases we have performed. And that number really drives home of what it is to have an experience like ours. You want to be able to come to a program that has not only experience in performing highly specialized cases, but having the outcomes to be not only great, but the adverse effects to be very low. This is what we're after. We want a good outcome with very low risk. So the other thing about having a good center of excellence is the supporting staff. All right, so we've been practicing over 10 years collectively, and so that really has yeah, so